How long does a Botox injection take to wear off? When you say 3 to 4 months to wear off, are you meaning 12 to 16 weeks, or actual months, which would be more like 13.5 to 18 weeks? And if somebody is bedridden, will the Botox injection take longer to wear off?
Thank you for your question. You're asking about the duration of effect of Botox, and you're asking about whether or not there's an effect if someone is bedridden. Well, I can certainly give you my answer to patients who ask this question every day in my practice. A little bit of background. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Long Island and Manhattan for over 20 years, and I, amongst my fellow colleagues in my specialty, were amongst the first to use Botox, so I've been using it for patients since 1993. And when I mentioned about asking this question every day, basically it's about the longevity. The bedridden part of the question is actually kind of unusual. But I think to really understand this, first there's some basic science that is related to how this works. But essentially, Botox relaxes muscles. It's a neurotoxin. It binds to very specific, we'll call them receptors, that prevent the nerve from telling a muscle to contract. That being said, in the lifestyle of someone who typically does Botox, and let's say on the face, they do it for crow's feet lines, for forehead lines, for frown lines, very common areas. Typically, the effect reaches a peak at about 2 weeks. Now when you ask how long does the effect last, well, technically the effect can last as long as 6 months. But on average, I tell my patients that the benefit that you like seeing pretty much wears off by 4 months. So generally, people come for these types of injectable treatments once every 4 months. Some people are too busy or they just don't have the budget for it. They'll come twice a year. The point is that it's not necessarily an on-off switch. It's a gradual, progressive return of function. Now there is variation. There are people where it wears off a little bit faster. There are people for whom it lasts a lot longer. It's sometimes comparable in some ways as injectable fillers like HA fillers or hyaluronic acid fillers. The thing is that it always ends up being individualized, and it's also about what that individual feels is the look and the function that they are comfortable with. Typically, people who want to maintain a certain look with more consistency, they'll come sooner. They'll come in at around 3 months. Others will wait, like I said, between 4 and 6 months. So as far as the question of being bedridden, I would say that there really is no significance to that because it doesn't have necessarily to do anything with activity. Sometimes if someone has a situation where the Botox may have worked a little too well in an area that they don't want it in, they feel like they can try to move that area or try to get the muscles to move. It doesn't make a difference. The protein, this actual binding with the receptor, goes away on its own through your body's internal molecular processes. So it's not likely that being bedridden will make much of a difference. So I hope that was helpful. I wish you the best of luck, and thank you for your question.